Hi, I am Dr. Jyotsna, Consultant Obstetrician, Gynaecologist and Laparoscopic Surgeon at the 9M Ankura Hospitals, Gachibowli. Fibroids are benign, non-cancerous lumps of muscle cells formed in the wall of the uterus. This is caused because of the genetic change which occurs in a few muscle cells, which causes them to rapidly divide and form nodules. Under the influence of estrogen and progesterone, they may increase in size and cause symptoms to the woman. Small fibroids don't usually cause any symptoms, but when the size begins to increase, the overall size of the uterus increases and they start to put pressure on the surrounding organs, and the shape of the uterus gets distorted. Because of this, the woman starts to feel symptoms like heavy menstrual bleeding, period pain, and urinary disturbances, sometimes even constipation. This can also cause a difficulty in conception. Small fibroids don't usually cause any trouble, but if the size of the fibroid increases, it causes an increase in the overall size of the uterus. It distorts the shape of the uterus and puts pressure on the surrounding organs. And this causes symptoms in the woman like heavy menstrual bleeding, period pain, urinary disturbances, constipation, and sometimes causes trouble with conceiving and maintaining a pregnancy. When these fibroids grow very large, they can undergo degeneration from inside, and that can cause a low-grade fever and continuous pain. Depending on the location of the fibroid, there are different types of fibroids. The submucous fibroid is close to the cavity of the uterus. An intramural fibroid is in the wall of the uterus, and a subserous fibroid is close to the surface of the uterus. The symptoms of the woman depend on the location of the fibroid and its size. There is no medical cure for fibroids. The only way to remove a fibroid is by surgery. Usually, symptoms determine the treatment of the fibroid, and where surgery is required is usually a laparoscopic or a hysteroscopic myomectomy. Myomectomy involves removal of the fibroid alone if patient is very young. In older women who require removal of the uterus entirely, a hysterectomy is advised. Depending on the location of the fibroid, there are different types. A submucous fibroid is close to the cavity of the uterus, an intramural fibroid is in the wall of the uterus, and a subserous fibroid is close to the surface of the uterus. And the symptoms of the woman depend on the location and the size of the fibroid. There is no medical cure for fibroids. A surgical treatment is usually advised where the symptoms are such that the patient does not get response with medical management, or if the size of the fibroid is too large causing compression effects, or if the patient is not conceiving because of the fibroid. In young women, a hysteroscopic or a laparoscopic myomectomy is a surgical procedure done to remove the fibroids alone without removing the uterus, where the need is to preserve the uterus to bear children in future. In older women, where the uterus is so large and it is causing heavy bleeding, we usually advise a hysterectomy, that is, removal of the entire uterus. This can be achieved either with a laparoscopic approach, a vaginal approach, or an open hysterectomy approach.